Hello students, I reduced the anemia slides to 14, but whatever I said for the uh, anemia yesterday, no, today, whatever I said today in the class regarding the anemia notes, so about the iron deficiency anemia, megaloblastic anemia, which is also vitamin B12 anemia, whatever notes I gave you in class about the anemia, those included, plus the explanation of sickle cell disease in the slides, is the content for the exam. And due to a time constraint, if I go in explaining the whole slides which I posted for anemia, it might take a lot of time, and we don't have that much time left. And yes, we all have gone through anemia PDF of all the slides, and you might be thinking, why did I go through all the slides when the anemia portion was supposed to be covered by the class notes plus the sickle cell disease? Well, you won't be regretting it, because whatever videos I am posting, they will be part of your comprehensive final exam. So your studying will not go waste. Okay. So um, anemia, I already explained it in the class. Now let's go to the next slide. It's a deficiency in the number of RBCs, deficiency in the hemoglobin, and also the packed RBCs, the hematocrit. Sickle cell disease, we discussed, it's a inherited disorder, and it is characterized by the presence of an abnormal form of hemoglobin in the RBC, and it is a genetic disorder usually identified in childhood. It is incurable, and if not managed can be fatal, and is predominantly in African Americans. It is often fatal, like if the child has been diagnosed in childhood, like in early childhood, that he has sickle cell disease. It is becomes dangerous by middle age because of the other problems which are happen because of this disease, which is renal failure, infection, pulmonary failure, or stroke. Sickle cell disease affects about 100,000 Americans, occurring in an estimated prevalence about 1 in 500 uh, African American births. It can also affect people of Caribbean, South and Central America, Arabian descent, or any East Indian ancestry. Um, uh, there is an abnormal hemoglobin, which is known as hemoglobin S, and it causes the RBC to become stiff and long, and they take the shape of sickle shape. And because of that sickle shape, the oxygenation of the body through these cells decreases. It's now substitution of valine glutamic acid on the uh, chain of hemoglobin. You don't need to worry about this explanation. The only explanation I want you to know is that this is an abnormal hemoglobin S, and there's a shape of red blood cell changed, and there is less oxygenation. Types of sickle cell anemia, and I said in class I won't be testing you on this. Sickle cell hemoglobin, and there's a picture which shows you how the hemoglobin it aggregates and it changes, alters the shape of RBC. So you see a normal hemoglobin and a sickle cell hemoglobin. So normal red blood cells are compact, flexible, and they are enabling them to squeeze through small capillaries. And when they are sickle red blood cells, they are stiff and angular, and they cause these sickle red blood cells to become stuck in small capillaries. So the shape helps in getting the red blood cells squeeze through small capillaries for body perfusion, but when they are sickle red blood cells, they are stiff and angular, and they cause them to become stuck in small capillaries. The major pathophysiologic event is the sickling of RBCs. Sickled RBCs, they become rigid and they become long and like crescent shape. Okay, as I said, the major point is that is when there is a sickling episodes or triggering episodes, and they are triggered when there is a low oxygen tension in the blood. Hypoxia or deoxygenation of the RBC can be caused by various reasons. It can be by bacterial infection, high altitude, emotional or physical stress, surgery, and blood loss. And infection is the most common precipitating factor. Other factors which can trigger or sustain a cycling episodes are dehydration, um, increased hydrogen ion concentration, increased plasma osmolality, or decreased plasma volume or low body temperature. A sickling episode can also occur without any obvious cause. So, uh, in the beginning, the sickling of the cells is reversible with reoxygenation, but as time progresses, it becomes irreversible because of the cell membrane damage from recurrent sickling. So sickling is in the beginning stages is reversible with reoxygenation, but as time progresses, there is a cell membrane damage, and it's difficult to get over with the sickling episode. So precipitating factors are definitely infection, viral or bacterial infection, any stress, surgery, any blood loss, dehydration. So fluid volume deficit, not fluid volume overload. So, in sickle cell disease, fluid volume deficit happens. Let's go to the next slide. Typical patient is asymptomatic except during sickling episodes. The effects of sickle cell disease vary greatly from person to person, and the severity of which may be due to, the genetic kind of genetic influence, the kind of sickle disease in the genes because of that. So many people with sickle cell anemias are in reasonably good health the majority of the time. However, they may have chronic health problems and pain because of organ tissue hypoxia and damage. And usually the vital organs which might get damaged are kidneys or liver. Symptoms may include pain, pallor, jaundice from hemolysis. If the episodes can actually affect any part of the body together at the same time with back, chest, extremities, or abdomen. And if there is a pain episodes, they will be accompanied by fever, swelling, tenderness, tachypnea, hypertension, nausea, and vomiting. Let's go to the next slide. Now, this is a very good picture of clinical manifestation of sickle cell disease, and with repeated episodes of sickling, there is a gradual involvement of all body systems, especially the spleen, lungs, kidneys, and brain. Organs that have a high need for oxygen are most often affected, and they form the basis for many of the complications of sickle cell disease. So liver and gallbladder, they can be hepatomegaly, gallstones, um, priapism, skin, ulcers of hands and ankles, bones and joints can get affected, hand-foot syndrome. In the eye, there can be retinal detachment, brain thrombosis or hemorrhage causing paralysis, sensory deficit, or even death. So these are some of the manifestations of sickle cell disease. Complications: infection is a major cause of morbidity and mortality. The function of the spleen becomes compromised from sickle RBCs. Um, Pneumococcal pneumonia is most common, and severe infections can cause aplastic crisis, can eventually lead to shutdown of RBC production altogether. Um, Aplastic crisis can be so severe it can cause a temporary shutdown. So uh, we don't want too much of sickling episodes. We don't want complications. So by by doing some patient teaching, the it can be managed. Complications, some of the complications are acute chest syndrome, which is a pulmonary complications that include pneumonia, tissue infarction, fat embolism, and patient can have fever, chest pain, cough, some infiltrates in lungs, and shortness of breath. And it can lead to multiple serious complications. Diagnostics test. A peripheral blood smear may reveal sickle cells and abnormal reticulocytes. So abnormal reticulocytes are seen in sickle cell disease. The presence of sickle hemoglobin can be diagnosed by the sickling test, which uses RBCs and exposes them to a deoxygenation agent, and they can see if there is a sickle hemoglobin. Electrophoresis of hemoglobin. As a result of the accelerated RBC breakdown, the patient has characteristic clinical findings of hemolysis, which is jaundice, elevated serum bilirubin, and abnormal lab test results. Hemoglobin electrophoresis may be done to determine the amount of hemoglobin S, which is responsible for the sickle cell disease. Skeletal X-rays will demonstrate bone and joint deformities and flattening. MRI may be used to diagnose a stroke caused by blocked cerebral vessels from sickle cells. Doppler studies may be used to assess for DVT. Other tests may be indicated, such as chest X-rays, to diagnose any infection or organ malfunction. Um, Nursing, we can administer immunizations such as pneumovax, influenza, and hepatitis. We can treat chronic leg ulcers, priapism, and patient can be hospitalized when indicated. We want the vital organs functionality to be preserved, less end organ damage, um, and we can teach patient to avoid high altitudes, maintain adequate fluid intake. I think teach patients to avoid high altitudes. You know, it came into 2 bullet points, which should be in one. Let's go to the next slide. I wanted to type something in here, but this is a blank slide. This slide was actually about the uh, what is the basic patient teaching for the patient who has a sickle cell disease. It is avoidance of high altitudes, maintenance of adequate fluid intake, proper treatment of infections, immunizations for pneumonia, and Haemophilus influenza and hepatitis. So all these immunizations should be given, and direct patient to seek any medical help when they are having these sickling episodes and symptoms, and especially when they're having their pain is so high, that it is compromising their um, homeostasis. Okay, so this comes to the end of anemia slide.